Welcome to Innoppl Inc.'s webinar. Today we are going to be talking about the state of mobility in healthcare. We're going to be doing an app demo and this little webinar here. It's brought to you by Innoppl. That's us. If you would, you can follow us at Twitter. We are at innopplinc.com, so it's www.twitter.com/Innopplinc. All right, no webinar would be complete without an outline. To let you know what we're going to be talking about, we'll give you an intro, the status quo, where mHealth and healthcare apps are at, some stats, talk about HIPAA, discuss about investing in mHealth apps and healthcare apps, and then we will move on to an apps demo. Let me just make sure we're good here. No questions there. Great. So moving forward. A little bit about us. We are Innoppl. We are innovation plus people, which equals Innoppl. We are a web dev shop based in Atlanta, Georgia, with offices in LA. We specialize in iOS, Android apps, Drupal websites, and Salesforce integration and implementation. So what's good about that is we've seen the healthcare industry from all sorts of angles, from creating their apps to their websites to actually implementing their CRM solutions that are HIPAA compliant. We've done quite a bit in this space. We're a growing company. We've been growing 50% every year. So we're excited to actually present to you some really neat stuff that we've noticed in the industry. Pi, I'm going to mute you really quick. All right. And there's our lovely faces right there, some of our team members. All right, moving on. So the status quo, I think everyone here has been to a doctor, hopefully once in their life. And if you've been there, you've probably seen a scene just like this, where there are several patients. They're all in line. They're all filling out tons of paperwork that may or may not make sense. And it's just not a fun experience for anybody. It's time-consuming. It's stressful. It's just a cluster, if you will. Nobody enjoys going to the doctor, and nobody enjoys standing in lines and waiting for their doctor for hours and hours on end. The system's not very conducive to patient care. On the opposite side of that, too, is the doctor. The doctor is also stressed with how the industry is right now as well. There's still a lot of paperwork. There's still a lot of information, and it's all not in one central place. Doctors move from room to room, paperwork to paperwork, idea to idea, and they're unable to actually do what they love to do, and that's help patients and heal people. So not only are people like us, the people that go to the doctor, frustrated, but doctors are as well. The system is not really great right now. In fact, Medical Practice Insider found that because of this, people are so frustrated with the system that there's a huge drop-off rate in customer, quote-unquote, patient retention and getting the patients into the office. So on a given day, if there's an appointment to go to a doctor, anywhere from 12 to 50% of those people that are scheduled will not go to the doctor. They don't like going just because they know they're going to stand in line. They know it's going to be not a fun experience. So they make an appointment, but they just don't show up, which is terrible because that means the patient doesn't get what they need health-wise, and the doctor doesn't get to treat them, and the business of medical doesn't get the money that they need to run efficiently and able to actually help people. Another interesting fact from the American College of Preventive Medicine, so those that do go to the doctors and actually do get their medical help and actually do get a prescription, there's some really interesting numbers around that. For every 100 prescriptions written, of those 100 prescriptions, only 50 to 70% go to the pharmacy. Of those people that do go to the pharmacy, 48 to 66 of them actually come right back out of the pharmacy without fulfilling their prescription. Those that actually do get their prescription, only a few of them take it properly, and then after they've taken it properly, even fewer of those actually get their prescription refilled. So what does this tell us? It tells us that people, when they do get their prescription, don't follow through. Maybe because they didn't have enough time with the doctor for the doctor to tell them why it's important. Maybe it was a bad experience, and maybe it's just this huge idea that it's hard to overcome and it is difficult to understand because the one-on-one patient relationship is not there. So in our mind, the current status quo is inefficient, ineffective, costly, and actually creates a huge barrier to access to health for millions of people in the U.S. So enter the solution. Hooray. Where there's a problem, we think there's a solution waiting to be found. We think that could be mHealth. mHealth, it means mobile health. It's a term used for the practice of medicine and public health supported by mobile devices. So in this webinar, I will be saying mHealth and healthcare apps interchangeably. They're pretty much the same thing, and they have the same function. Interesting factoid, this gentleman right here, his name was Frank, and he actually had the first healthcare app idea way back in 1977. He got an Apple II computer. He was fascinated by it, and he loved it, and he thought maybe we can write some algorithms to make things go smoother in healthcare. So he pitched the idea to old Steve Jobs at Apple in 1977, and Steve Jobs actually turned him down and said that's not the direction that we want to go with our company. So this idea of mHealth and mobile healthcare has been around since 1977, way before smartphones and tablets and so on. We're just now starting to see it in our current reality. So there are several types of mHealth apps out there. We have education awareness, helplines, diagnostic and treatment, communication and training, monitoring, data collection, disease and epidemic outbreak, and a whole bunch more. Anything that has to do with health kind of falls under this mHealth idea. Interestingly enough, some big brands are starting to jump on this mHealth idea. You've got Microsoft, WebMD, American Red Cross, Weight Watchers, and really a whole lot more. Some big players see the potential here and are getting really involved in the space. Some really neat apps to think about as examples. There is Health Tap, which lets you actually talk to a doctor in real time from anywhere in the U.S. Just open up your phone, open the app, and you can talk to a real live doctor. There's also another really neat app called Instant Heart Rate that takes your heart rate from your phone. That's cool. And then there's also this pulse oximeter tool from Children's Healthcare of Atlanta, which tells you your blood oxygen level and whether or not you need to go see a doctor. So let's talk about mHealth statistics. Sure, there's this idea that people want these mHealth apps. Sure, mHealth apps are out in the marketplace, but what do patients want and what do clinicians want? So some really neat facts from Practice Unite. 80% of people, patients like you and me, want to interact with healthcare via their smartphones. Also, 56% of U.S. adults want to monitor their health with a connected health device, think an iPad. And over half of tablet users over the age of 55 are currently using their tablets for health purposes. So patients want apps. They want apps on their phone, and they want those apps to help them get access to better health care and quicker access to their doctor. On the doctor side, they love the idea of mHealth apps. For example, in Europe, there's been calculated that using healthcare apps, paramedics and doctors can save over 472,000 doctor days a year, just all combined with the efficiencies and the removing redundancies. It's incredible. Currently, 50% of physicians are using their mHealth technology every day because they really enjoy it. And 86% of healthcare professionals believe that health apps will increase their knowledge of patients' conditions. So patients want it, doctors want it, everyone wants it right now. So what's next for mHealth? People want it, right? Well, we think there's going to be a big growth, lots and lots of growth in this space very, very soon. In fact, Practice Unite again is projected by 2020 that the mHealth global market will reach $49 billion. You can see this orange arrow here. That is 2015, where we are currently at. And then if you look over to the far right, you can see 2020, and that is 3 times the number where we're at for mHealth app marketplace. It's going to be huge, huge growth, huge, huge earning potential, and even better than that, more access to healthcare for patients, saving lives, making people happier, giving them better lives. So from our perspective at Innoppl, we predict a huge surge in mHealth apps in the next 25 months. We're thinking even larger brands are going to start getting into this space, that more so than they already are. More importantly, niche innovations from healthcare is going to happen here very soon. We've been talking to some healthcare providers that really get into these niche health spaces, and they see how an mHealth app can really make their lives easier and their patients' lives easier. We're going to see an increase in security feature and hopefully more flexible regulations. So let's talk about regulations. No healthcare discussion would be complete without HIPAA. HIPAA was signed into law by Bill Clinton back in 1996. This predates the first iPhone by 10 years and the first iPad by nearly 14 years. So when these regulations took place, no one had any idea that we would be in the current space that we're in with smartphones in most everyone's hands and people having access to technology like they never had before. So the rules were not written for technology. They were written for paper. They were written for forms. They were written for processes. So what is HIPAA? Basically, this great graphic sums it up. Knock, knock, who's there? HIPAA, HIPAA who? Sorry, I can't tell you that. Basically, HIPAA doesn't allow anybody to share information, and it encodes and it prohibits people from ever seeing it. So if you go to your doctor and you have a patient conversation, any records need to be programmed to where if they're hacked, they can't be seen. You should worry about HIPAA if you have an app or you're thinking about an app. You should start thinking about HIPAA if your app stores, collects, or manages any personal health information. Whatever that means. It could be blood type, it could be medical history, it could be family history, so on and so forth. If there's any personal health information or patient health information, if your app stores it, you should think about HIPAA. Also, if you send emails from your apps that have PHI in them, they're for healthcare purposes, you need to think about HIPAA. Also, if you do any push notifications from your app and you want that app to be a healthcare app, you need to think about HIPAA. So take home, if your app deals anything anywhere close to PHI, personal health information, patient health information, then you need to think about HIPAA. If you don't, there's huge fines waiting for you, which are not fun for anybody. The next question we always get when we start talking about HIPAA is, with all these regulations, with all that's going on, should I invest in an mHealth app? And we think yes, if you can answer 3 to any of these. When we start to see people that are successful with their healthcare apps, they usually have at least 3 yeses to these questions. They either know the industry very well, have a unique idea that's not in the market, have a better idea that's not in the market, have a budget of $40K or more, have some kind of clinical experience, know how market penetration works in healthcare, and know a niche very, very well. The big one to note here is, of course, knowing a niche. I think that's super important. But also budget. It's not cheap to make a healthcare app. There's a lot that goes into it, especially with making sure that it's HIPAA compliant. So if you don't have $40K to spend and more, we would probably steer you away from getting into the healthcare app market right now. And it's not going to get much cheaper as things move forward. So with that, we are going to demo 2 of our apps. Here are just 3 examples of some apps we've created in the healthcare space. The ION app. We made an app for the Children's Healthcare of Atlanta and Liberate Health. Today I'll be demoing the Children's Healthcare app and the Liberate Health app. So let's move into that.